Afternoon. Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. The goal of the series is to explore relevant public health topics with members of our community. Today's webinar is a conversation with state and local health department employees. We'll be talking about working through a global pandemic, surviving, and even thriving. Our panelists are all alumni of the School of Public Health's Master of Public Health program and currently work at state and local health departments in Georgia and in South Carolina. They are Ashley Moore, epidemiologist at Georgia Department of Public Health, active bacterial core surveillance and meningitis. Bethany LaClair, epidemiologist at Georgia Department of Public Health, foodborne illnesses. Philip Hudson, program consultant at Georgia Department of Public Health, violence and injury prevention. Curtis Sarkar, epidemiologist at Gwinnett, Newton, and Rockdale County Health Departments. And Sunanda Sarkar, epidemiologist at South Carolina Department of Health and Environmental Control. Before we get started with asking the panelists questions, I would like to poll our attendees. What best describes your current employment status? So it looks like the bulk of you are a graduate program and looking for public health employment, or are currently employed and looking for ideas to advance your public health career. So I think this will be a great conversation, and please feel free to ask questions in the Q&A box. I'll definitely try to monitor that as we're having our discussion, but we have left a little bit of time at the end for Q&A, so hopefully you'll be able to stick around for that. So I wanted to start by going to Ashley first, and can you share with us, Ashley, what your position looks like during a typical day or week, both before the COVID-19 pandemic and then maybe how your role has changed since the pandemic hit?
Absolutely. So one of the biggest differences is I'm at home. We are no longer in the office full time. We can periodically go in to take care of any requirements or what have you, but most of us are not attending the office full time or 5 days a week. So before the pandemic, my job was primarily surveillance and checking our state disease notification system and trying to identify any cases of reportable conditions that are of public health concern. For me in particular, it's invasive bacterial diseases. For some of my colleagues, it's some of the other notifiable conditions. And we look for trends in disease, and we also respond to outbreaks. Now, post-COVID, I do a lot of the same things just from home, as I mentioned. I'm still checking our notification system routinely, several times a day, and monitoring for any unusual trends and trying to respond to any outbreaks that may occur that are that aren't COVID. But primarily since COVID, most of the resources and most of the time for our staff has been dedicated to responding to the COVID outbreak. And each of us have contributed, a portion of our time to that response. When it's tapered off a little bit as we've hired more people to kind of, and as the outbreak has waned a little bit, but that's kind of what it has looked like.
Great, thank you. I'll come to you, Curtis, next. If I'd like to ask you a little bit of a similar question, and I know you started as an intern in the fall of 2019, and I'm curious if you can tell us what kind of activities you were pursuing at that time, and then how your role has changed as the pandemic has unfolded.
Sure. So first of all, I just want to thank you, Jessica, and then the School of Public Health for allowing me to do this. But yeah, so before COVID, I was an intern at Gwinnett County, and I was doing work for our TB clinic and our STD HIV clinic. So a lot of data entry and just kind of helping out with some of our HIV outreach events and just helping out patients who came in to get treated for their TB or came for testing and stuff. So just kind of being in that kind of allowed me to have the position to help out with the pandemic, as the pandemic was happening, and you know, finally got the chance to do other things, and you know, it was definitely an experience.
So just as a little follow-up, Curtis, how did it work for you in terms of transitioning from an intern to a full-time employee? Do you feel like you got that position because you were interning already and kind of were immersed, or can you talk a little bit about that?
And I think it was a little bit of both. And I think, you know, having that experience, being familiar with a lot of the people here at GNR and kind of the process of how everything is, you know, handled here. And then also, you know, just being there at the right time, like at the time when the pandemic was happening, both of those really played a part into getting this position and, you know, having that trust in me to, you know, to help out with case investigations and all the data work and stuff. You know, so.
Great, thank you. So I'm going to move next to you, Bethany. Will you just briefly tell us a little bit about what your role is at the State Health Department?
Sure. So I actually started out at DPH as an intern. So Jessica got me to my practicum, which I did my practicum with Ashley. So she was actually my mentor. So that's how I started out at DPH. And then I got my job. And what I do is I am the food net coordinator, which means that I coordinate all of the surveillance activities associated with the Foodborne Disease Active Surveillance Network, which is a part of the Emerging Infections Program with CDC. So I handle kind of their surveillance for 8 different foodborne pathogens.
Okay. So now that we kind of have an idea of what your position is within the state, can you tell us a little bit about what you perceive to be some of the advantages to working in state public health and disadvantages, if there are any, and maybe kind of how that might differ from federal environments?
Sure. So I've actually only worked at the State Health Department, but I work very closely with our local partners. So I, of course, can speak to what, you know, a local partner does and what a state partner does. So I can't speak directly for what happens at a federal level, but I can kind of talk about some of the advantages that I see working for a local and state health department. I think one of the big advantages for me is that, you know, I'm able to you know, I'm able to make a direct impact in my community and where I live. So the work that we're doing, I'm able to see the fruits of my labor directly into the community in which I live. So, you know, a lot of times I'm working and calling cases that might live down the street from me or in another county. So I love being able to work in my community and know that at a state and local level that we're really making an impact in our community versus maybe working at a federal level. You know, you're working at national data, you're working at large data sets, not to say we're not working at large data sets, but you know, I'm able to see the fruits of my labor more, I think, working at a local health department versus, or a state health department versus, you know, working at a federal agency. I also think that one of the advantages as well as working for a local or state health department is that, you know, you get the opportunity to kind of like broaden your experiences. So sometimes, especially at our local health department, you know, they're working on a variety of different things, especially if someone works in kind of what we call our acute diseases. You know, they might be working in the morning on a zoonotic disease and then in the afternoon working on a vector-borne disease versus, you know, at a federal level, I feel like you might be a little siloed into the department that you work in. So if you're hired to work on a specific project, then you know, you might be only working on that project and not get the opportunity to kind of like expand your experience or knowledge elsewhere. I can speak a little bit directly about what we experience at the Georgia Department of Public Health. We have, I think it's biweekly, it's kind of changed now that COVID has happened, but we have what we call acute disease epidemiology section meetings. So it means that all the epidemiologists from the acute disease section come together and we get to hear about what's happening in the other programs. So I might get to hear what's happening in hepatitis or in healthcare associated infections. So I feel like while I'm not working on those directly, I have a seat at the table and I'm able to hear about the other things that's happening across our state, which I think that you might not get that opportunity at a federal level. So I think that's some of the things that I value and I think are truly an advantage of working at a local or state health department is that you get such a broad level of experience across various different subject matters. One of the things that I would say is a disadvantage, which I think is just a public health thing across the board, is that sometimes at a local or state health department, you can come into funding restrictions, which I think happens all over, even at a federal level. But I feel like sometimes at a state or local health department, you might feel them a little bit more. So you might have restrictions of, positions that you may be able to hire or how long that position will last because of certain funding restrictions. But I love working at a state health department, so truly that's the only disadvantage I can think of right now.
Okay, well, thank you so much for your candor. That leads me to another question that anyone can respond to, Bethany, or anyone else on a panel. Some of our graduates and students are interested in working in state and local health agencies, but they see kind of low salaries. And so there is sometimes a disparity between the state salaries and the federal, or maybe some of the larger nonprofits like American Cancer Society or something like that. And I'm curious what you would say to someone who's considering the health department, but maybe is hesitant because of the disparity in the salary.
Sure, I'll speak really fast since I'm unmute. But I think one of the things that I value, yes, there is potentially a discrepancy in pay between a state health department or working at a federal agency. But at the Georgia Department of Public Health, we tend to have a lot of flexibility about teleworking, especially right now with COVID. But even before COVID, we had the opportunity to work from home and a little bit more flexible hours. And I think also one of the things that I value is that I love the people that I work with and the culture that we have at the Department of Public Health, which is something that I value a lot. And I think Ashley would say the same thing, is that we work closely together, is that, I work with a group of people and they're my friends, and I love, working with such a strong support system, which is something that I value a lot in, what kind of job I'm looking for or what environment I'm looking to work in. So I think that that would be something that I would look at too, versus also just the pay scale.
Right. Did anybody else want to weigh in on that? Or if not, we can continue on. Okay, so I wanted to come next to Philip. A lot of the other panelists today are epidemiologists by training, but you and Sunanda are biostatisticians. I'm curious if you can tell us how you found your niche at Georgia Department of Public Health and what maybe has been most helpful to you in growing in this role.
Yeah, absolutely. So I was a bit of a untraditional student or a non-traditional student in that I had a previous career in law enforcement before I decided to come back to school. And I came to the School of Public Health here at GSU, where I discovered my love of biostatistics. While I was here, I actually made a connection at the Georgia Department of Public Health through one of the professors, and I started an internship, and that eventually led to applying for a part-time position while I was finishing my degree. And after I finished my degree, I applied for a full-time position in the injury prevention program, and that's where I am now. Where as a program consultant, I basically am the on-staff biostatistician for the injury prevention program, so I can handle all their data needs, because it's a very dedicated program, but it's largely programmatic focused, but we have a lot of data needs in line with all of our grants, and I handle that. My two main areas of focus are the Cardiff Model of Violence Prevention and the Core State Violence and Injury Prevention Program. So I've been able to use the biostatistics skills I've picked up at GSU to do things like strengthen our grant applications, perform geospatial analysis to guide resource allocation in our programmatic efforts, and to do a lot of large data set analysis for things like grant reporting. And I've continued to collaborate with colleagues at, for example, Emory, CDC, et cetera, on manuscripts as I've been working there. So yeah, that's how I've gotten to where I am.
That's great. Thank you. Thank you so much. I'm going to go next to Sunanda. Your background is in biostatistics as well. I'm curious if there were any skills that you had to learn on the job when you were hired as an epidemiologist, and if you feel like your strong analytical skills helped you stand apart from others who may have been in that epi role.
Absolutely. Hi, everyone. This is Sunanda. And first, I would like to thank Jessica and our School of Public Health for giving me the opportunity to share my experience with you. So regarding that question, I want to say that I'm grateful to our GSU MPH program. Our MPH curriculum was great. So I actually had the opportunity to learn diversified skills and gain a range of knowledge in both biostatistics and some in epidemiology too. So actually, I was not required to learn any new skills for this position technically. However, I believe my skills and expertise in biostatistics helped me to get hired for this position. Since more than 70 percent of this position's responsibility involves working with data and other data related role. So actually they were looking for someone who had more data related experience. Though technically the job description or job title is epidemiologist, but they were looking for someone with more data related experience in here. So after I started here working in this position, I have found that my responsibility is a little bit different than others in the AP position in my division. So yes, that's how I think my strong analytical skills help me to stand apart from others in these positions, others in this role.
Wonderful, thank you. One of the challenges that I think a lot of us have in this year of virtual life is just kind of staying connected to our teams at work and to our supervisors, or maybe if you're in a supervisory role, the people that work directly under you. This is for anybody to weigh in on, anyone, and to answer. I'm just curious if you have found any unique ways to keep in touch with the people that you're working with. I know that one of the ways people are eager to advance their careers, you have to make sure that people know what you're doing and see the value in what you're doing. And so if anyone has creative ways that they have come up with to make sure that their supervisor continues to see their work, I would love to hear any thoughts about that.
It may not be terrifically creative, but what's worked for me has been just scheduling check-in calls to make sure that we're not missing each other, so that we know what each other's doing, what my supervisor's goals are and what I'm doing, and to make sure that those align and that we're all on the same page. As well as with my colleagues, we'll also schedule just social interactions. And if it's on the schedule, everybody's Outlook calendar is how you get a hold of them. So it's very important.
Yeah, I think that's a great, yeah, Curtis.
Oh, I just want to add the way we've been doing here at GNR. We got about 100 plus case investigators through DPH to help us with our case investigations for the county. And some of the ways we keep in contact with everybody, just to know that we're on the same page, is we schedule them on our own terms using When I Work. So we kind of work with them to have their schedules planned out. Then we also do weekly Zoom meetings just like this, and we kind of just go over kind of a run sheet of any updates, any guidance updates and stuff like that, so that we're all in the loop. And then we also, any new hires, we also follow up with them and do audits. So we'll collect some of their PUI numbers, or that's just the way we identify COVID cases. And then we just kind of look through their work and see if, they need to, any adjustments could be made, or what, we can do better. And that's a good litmus test to see, where's everybody at, and then we can discuss that further in our Zoom meeting and, really polish our process.
Mm-hmm. So I think a lot of you all in your responses to the things that we've talked about so far have really hit upon this idea of increased flexibility. I think this time period has really laid that as the foundational skill that I think we are all needing to bring to the table, is just to be flexible and to be open to taking on new responsibilities and to helping out on teams that maybe you weren't previously a part of. And one of the questions that came into the Q&A was, what sort of traits are employers looking for from undergraduate applicants in the era of COVID? And I don't know that this would be different from, if undergrads would be different from just anybody, but it seems like flexibility is definitely a big one. And I'm curious if the panelists have any other ideas for this question.
I would say communication is a big one, whether that be written communication or verbal communication. Talking with your supervisor, talking with your colleagues, just to kind of communicate about, what you are looking for, and making sure that it's in alignment with the position that you're seeking. I think a lot of us are kind of open to communicating and sharing our experience. As you can see, we're all on this panel, and I think that's a big help. yeah, I think communication is really, really key, especially now, this kind of day where it's more difficult for us to get together in person.
I was also to add that, you know, sometimes what you apply for or what you expect, you know, it might be something totally different. And, you know, just the willingness to just say yes, take the opportunity and just kind of see, you know, what comes out of it, because it might be something you might end up being really interested in, passionate about. So just, I guess, having the willingness to say yes to whatever, you know, opportunity or, you know, where they feel like, you know, they want to place you. But yeah, I would just say, just be open and willing to just take on any challenge.
And just building off what my two other panelists said, one of the big things for me is showing a genuine interest in the specific position you're applying for. I don't expect everybody to be subject matter experts, but I do a lot of hiring panels, and it goes a long way when someone comes in, you know, having looked up the website or read up on the subject matter on the CDC's website, so that they show a genuine interest in the position and not just that they're looking for any job they can apply to.
Yeah, I was going to say something similar. I've done I've been on panels during COVID, and I think also something too that I valued when in candidates is that they have a strong sense of personal initiative. You know, they're able to work on a team, but the fact that we're all mostly working from home now, you have to have the ability to be able to work independently and to piggyback what Ashley said, and be able to communicate effectively if you are having questions or anything like that. But somebody who can work in a team, but also just really stay focused on a task and have a lot of strong personal initiative is valuable.
Yeah, I want to go with my other panelists too. So I agree with them. They have to be open with their experience and their knowledge. They are not shouldn't be specific for a particular position, and also communication, maintaining a good communication is very important in here.
Yeah. Thank you so much for sharing those responses to the question. You know, I think that one of the themes that seems like is coming up is that hardly is the job description, you know, just the job, right? Like there's so many other things that are going to come along, and a global pandemic pops up. You know, no one, I guess some people were expecting it, but maybe we weren't expecting it to be, you know, quite as bad as it was. But, you know, just sort of that acceptance of kind of going with the flow. And I think that initially in our working lives, sometimes we get into that situation and we're like, wait a minute, this isn't what it's supposed to be. It's supposed to be this job. And, you know, the important lesson here is that it's never just going to be that job description. It's always going to be fluid. It's always going to come with surprises. And so, you know, the beauty of it is that if you go with the flow and roll with the punches and kind of, you'll learn, okay, I like this new thing. I really like working on infectious disease, or I really like working on emergency response, or maybe it becomes the thing that you cross off the list. You're like, you know, this is just, I don't thrive in this kind of working environment, or I, you know, would really like to try something else. And that's really what this whole thing is about. That's really what our careers are about, is learning about ourselves and learning about the work environment and the work culture, and perhaps growing within that environment or pivoting to another phase of your career. And so I think all of those lessons that you all mentioned are so helpful and so valuable to hear. This is another kind of broad question, but from our attendees, curious in how you chose your career. And so if anybody wants to speak to that, I know sometimes your career chooses you, but if anybody wants to share, you know, how they came to be where they are today, and want to be open about that.
I'll start. I didn't know what an epidemiologist was when I started undergrad. I had no idea. I wanted to be a forensic scientist, still science. And when I graduated, that was the goal. And so when I pursued graduate school, I have 2 master's degrees. One of them is in applied environmental microbiology. And I was like, okay, I'm going to get into this micro, I'm going to get into a lab, I'm going to work in the lab, and that's going to be great. And that's going to be my life. And I worked in a lab for a year and hated it. And it was like, oh, nope, this is not for me. I don't want to do this, but I didn't want to lose all these years of science education that I had gone through. And I happened to attend and she became my mentor. She's no longer at the School of Public Health, but Dr. Karen Giesiger, she introduced me to public health at Georgia State. At the time, it was the Institute of Public Health. And she introduced me to epidemiology, and in particular, infectious disease epidemiology. And I was like, wow, this is absolutely amazing. This is my niche. This is my home. This is what I want to do. And from then on, I just took classes to kind of further advance that career. And I did practicums and things like that to kind of pursue that. And so that's kind of how I fell into epidemiology. So, yeah.
I can go next. So my background's actually in education. So I went to Mercer with a major in biology and a minor in education, and actually was going to teach high school science. But it lucked out at the end of my semester at Mercer, they didn't have a class that I needed to take, so they let me sub in a public health class. And when I took the public health class, I just loved it. I was like, oh wow, this is so interesting. So I actually started GSU doing more of a health promotion. So I took a few years off in between graduating from Mercer and going to grad school, and I worked in health marketing for a few years. So I actually was going the health promotion route and not going to do epi, but then I took intro to epi and just loved it. And I thought that it was a great niche for me. I loved math, but I also loved working, just talking to people. And I felt like with case investigations and also, the science behind epi, it kind of blended both of my favorite things together. And it's just truly something I love. So.
And I think for me, it really started like in high school after I was taking a microbiome class at the time, and I was watching an interview or a documentary about, some CDC scientists going to like Africa to like study Ebola or something like, I think SARS or Ebola or something along the lines of that. And it just, I don't know, it really kind of inspired me. I was like, wow, there's really like people who like go out and, to the world and, look for viruses or, it kind of interested me. But then once I got to college, I was more like I was on the fence about, public health or like maybe pursuing like the medical field and becoming like a doctor. But I soon found out that was not really, what I felt like, what I was interested in. And, I took a gap year just to really figure out, what I wanted to do. And then just reminiscing all the time in high school, how inspired and how interesting I thought public health was. I was like, let me do some research on it. And then I saw GSU was, had a master's program to do it. So I was like, you know what, let me try this because I love the science field. And, it's in public health, and especially being an epidemiologist, it's not like exactly being a doctor, but kind of helping, populations, groups of people, and kind of diagnosing what's going on in a community, and helping people on a larger scale like that is what really attracted me, to epidemiology and really pursuing this, with my career. So.
To build off of that, I was in law enforcement for 8 years. I had various investigative roles, including working in special victims. So I had a lot of hands-on experience in dealing with a lot of different topics that are, we also deal with in public health, but I had decided to leave that field. So now in public health, I'm still dealing with a lot of those topics that I used to work on, wide ranging from substance abuse, suicidality, child abuse and neglect, any number of other topics that are very important. But now I'm working on primary prevention at the population level instead of tertiary intervention at the individual level, right? And as we all know, prevention goes a lot further if we can just get people to fund it. So that's the challenge.
Mine is totally different. My undergraduate degree is in medicine and surgery, and I used to work as a medical doctor for several years back in my country. And actually, I never felt that much interested in clinical medicine, and I was always looking forward to the public health field, but I didn't get a chance back then. However, going through some transition, moving to USA, and took several years gap, and then I found this program and get into this program. But I started as an AP, and then I got the class first fundamentals of biostatistics 1 with Dr. Lai, one of the most popular faculties in our JSU School of Public Health back then. And I totally fell in love with biostatistics 1. And I was like, you know what, I can change my concentration to biostatistics, and I can go for that. And that's how I changed my concentration, and that's how I became a biostat major. And still now I'm looking for like something to work on every day while I'm working for this position or any position. I always look for something to work that's related to data. That's how I changed my career, and that's how I'm in this position now.
Thank you. This question is also for any panelists to answer. The pandemic has been so tough on state and local health department employees for a variety of reasons, just sort of the pressure from the public, from elected officials, to, I think Curtis mentioned they brought on 100 new employees because we have all these contact tracers. And so there's just been a lot of change. And I'm curious how all you think will change for your agencies and colleagues once the pandemic has come to an end. How will things be different when life somewhat returns to how it used to be?
I'll go ahead and add to that. So like right now, it's been more difficult to assign cases to the cases, or for case investigators to assign the cases, just because cases have been dropping and stuff. So figuring out ways to keep our CIs busy, while cases are getting lower. But then maybe, considering having them work in our vaccine clinic, because that's more of the focus right now for us is, getting the community vaccinated, and then kind of also scaling back some of the processes that we've had established already. So, starting to consider, other notifiable diseases and revisiting that and brushing up on that, just to slowly start transitioning back to those old, reportings that we used to do. So, yeah, that's just been keeping us on our toes. And so.
Yeah. Do you think there will be a renewed interest in funding public health, just infrastructure and programs?
I think there will be a renewed interest. The question is, will it be sustained? And will it be long-term funding that's supported, into, 10, 20 years down the road? Because some of these public health programs, they take time for the work to kind of come to fruition. And, we're a society of, I need immediate need or response or what have you. And that's not always the way public health interventions work, especially when you're dealing with issues on a population level. I will say one interesting tidbit or kind of thing about COVID is, kind of the mitigation strategies that we put in place to control COVID, at least for my diseases that I study, they have also gone down as well. So that is an interesting little, quirk about what happened with COVID and the strategies that we use to kind of bring it under control. It kind of helped some of our other conditions. So who knew that locking the country down would, interrupt disease transmission in certain areas. So, yeah, but I do hope that the funding is sustained, and that local and, because a lot of times CDC gets a lot of the funding that they then distribute. I'm hoping state and local health departments are a part of the conversation, moving forward and are included in kind of the federal funding packages that are put forth, and also become, part of line item budgets on state for state budgets, state and local budgets as well.
I wanted to go back to something, Ashley, that you just said. You mentioned the budget becoming a line item, or the funding becoming a line item in the state budget. I don't want to put you on the spot too much, but can you say a little bit more about that? Or I think that there's sometimes mystery around how the funding of public health works, or maybe there's not mystery, maybe just confusion.
Yeah, so state and local health departments get a lot of their funding from CDC programs. Like my position is grant funded through the Emerging Infections Program, which is a CDC grant that we've been getting for quite some time now. And we plan to continue to get, but it is a competitive grant. So we do have to deliver on our performance measures and, write up a grant and send it to CDC, and they can, they haven't up to this point, but they can, rescind funding or not fund certain items or what have you. And so, our goal is to always make sure that we are, on top of everything. Now, as far as the line item in the budget, in the state's budget, a lot of EPI, at least for the Georgia Department of Public Health, is not state funded. It's mostly federal dollars that support our, STD program, our acute disease EPI program. It's mostly federal money. And so the portion of money that is spent on the portion of state dollars that are spent on EPI and other public health programs is low relative to other states. I think Georgia is like 38th or something in terms of state public health funding. And, I do feel like we could be a lot, not getting too political here. I do feel like we could be a lot better supported at the state level, just in general. But that's neither here nor there. We don't really have the authority to kind of dictate that, but yeah.
Thank you. I'm sorry again for putting you on the spot. I think it's just so interesting, and it's so, a lot of us just don't realize that is kind of how it works. I think we take for granted that our public health infrastructure, will be there, but it's not really set up in a way, to have that solid, consistent foundation. And so those of you in health policy, that's your charge, right, is to educate the public and to educate people and advocate for maybe a different method for supporting our state and local public health agencies. I wanted to hop back over to the chat box. There were a couple of questions that came in. One was if you have advice for people who may not have enough experience in the profession they're seeking. The example was how can they tailor their resume to fit a job description when maybe they have experience doing one thing like in environmental health, but they're interested in moving their career to maternal health. Does anybody have advice on how to maybe present their skills?
So as someone who made a pretty big career transition, I would say find the common skill sets, even if the subject matter is different, and just make that bridge and do everything you can to help your potential employers see how the skill set connects, right? Even if the subject matter is very different. Because a lot of these public health skills are very transferable. We already talked about how close epi and biostats are, for example, and environmental health is going to be very similar. So just tailor it so you focus on your skill sets more than the subject matter would be my short advice there.
I totally agree with Philip, and that worked for me. I can guarantee that.
Yeah, I agree. And I also would say it might be helpful to, if you can have the opportunity to reach out to somebody in whatever field that you're looking to go into and find out what skill set they're looking for and determine what skill set they value in that position. And then, regardless of your experience, you can take, or regardless of your previous position, you can take what experience and skill sets like Philip talked about and kind of, use that, to enhance your, your resume or your interview.
Thank you. And I mentioned, just typed back into the box, is just thinking about bringing in some of the stuff that you've done in your classes. If you're interested in maternal health, then every paper you write should be about maternal health. And you can pull some of that into your resume, and then any volunteer experience that you may engage in that's in maternal health should be featured on your resume too. We got another question in the chat, and so all of you have a Master of Public Health, but the question was, do you need an MPH to work in public health? And so maybe you all could answer this based on colleagues or people that you've hired while in your work. This person was saying that they are postgraduate with a DNP, registered nurse, and wants to do health promotion and disease prevention. So from your experience, is the MPH necessary? I guess there's a two-part question. I think sometimes, is it necessary to get into the field? And two, is it necessary in advancing in the field?
I think it depends on the position you're trying to get. If you want to be an epidemiologist, you need an MPH. But if you are trying to get into like health education, I think the CHES certification would be a helpful tool to have, but maybe not necessarily an MPH. If you can demonstrate that you have coursework that is consistent with the requirements. I do think that some of the, like, we hire public health nurses, we hire who obviously need an RN degree. We hire, and they can serve as health educators as well, and immunization coordinators. What else? We also have communicable disease investigators, or CDIs. Those, they don't need an MPH in order to break into the field, and they do quite a bit of surveillance work. So the short answer is no, you don't need one necessarily, but it's going to be position specific.
Yeah, and I think one of the things about public health too, being grant funded, so many activities being grant funded, and needing to be in a position where where you understand the literature, you can write about it, you can write about theory that's going to support whatever programming you're proposing to do, or evaluate that programming. I think those are some particular skills that you gain by doing an MPH, and that are very necessary when working in the field. But I guess I would kind of echo, and there's a lot of nodding heads while Ashley was talking, that it really is position specific. And then some of the organizations that you go into, the expectation as you move up is that you have more letters behind your name. So I think that's definitely something to study too, is just sort of like the culture and advancement within a particular organization. I have another question here in the chat that I want to make sure we get to. In light of Her Story Month, so like Women's Month, what are some challenges women still face seeking leadership professions in public health? Can you share experience? And do you find it tougher to advance in this profession since the pandemic? So it sounds like kind of two separate questions, looking at the challenges that women still face in gaining leadership positions is part one of the question, if anybody wants to share experience about that. It's a tough one.
I'll share a little bit about my experience, just as far as, women in public health. I will say at the Department of Public Health, though we dominate, women as primarily women at the Department of Public. We have a lot of women in public health at GDPH, but I would say the biggest advice that I can give, and it really goes out to anybody, but specifically for me as a woman in public health, is that you have to be your own advocate, and you have to be able to do your research and know what your partners around you, as far as salary or what their leadership roles are, kind of understand what might be expected of certain positions, and do your own research and be an advocate for yourself. Know your value. And I think that that's important. If I'm presenting myself as I want a promotion or whatever, I'm going to do my research as to what, my counterparts make, or, what their skill set is, or what their experiences is, and know, what I maybe need to be working on, or what I can bring to the table. So I think being an advocate is the biggest advice that I can give you, at least in my experience.
And I would add, for leadership roles at DPH, quite a few of our leadership roles, our state epi is a woman, and some of our, team leads are women. So there is an opportunity there to advance and move up. That isn't it. I'm not saying there's not a glass ceiling, because there definitely is, but there are a lot of leadership roles. Even the commissioner, which is an appointed position, but she's a woman as well. So, I mean, in some of the highest echelons of our particular organization, women are the leaders and at the forefront of decision-making and progress. And so I do think, as Bethany said, you do have to kind of be your own advocate, and definitely understand the culture of the environment that you work in, and how you can, progress in your career. It really is kind of up to you to kind of demonstrate that, you are the best candidate for whatever position you're seeking.
I would say the same from South Carolina. So in our DHEC is also women dominated, and I want to say that our bureau director and our public health director is a woman. So that's how I know that this is like women dominated field. And I want to go with the same tone with others, that you have to be your own advocate and focus on your work. So never see yourself as a woman, but see yourself as a person, and always focus on what you are doing. So that's how you will be advanced in your position.
Curious if anybody has advice on this concept of like leading from the chair you're in, like if you aren't in what is perceived, you're not in like a director or manager level position, ways for you to lead from where you are, whether it's, leading up a team or helping to, amplify the voice of a colleague. Are there ways in which you found that you've been able to do that? And if you don't have a response to that, you can also weigh in on the second part of that question, which was, is it tougher to advance, since the pandemic, or, is that happening?
I think, honestly, because we've gotten so much COVID funding, at least at the state office, I think people have been able to advance a little bit easier now because the funding and the support is there. And you also want to retain, a company that spent a long time investing in you wants to retain its employees. And if you're like, hey, I'm going to bounce, if you don't, raise, these are all the, attributes that I have. I feel like I deserve a raise, or what have you, or I feel like I deserve this leadership role. I do feel like, COVID has given us opportunities to advance, to lead different teams that have been created as a result of COVID. in addition to our regular duties. So if you want to step into something that's kind of a little bit outside of your wheelhouse to kind of demonstrate that you have, that you can learn additional skills, that you can lead, that you can head up. COVID has presented several opportunities, at least at the state office, for people to do that and to kind of get a little bit more experience, not only in responding to a pandemic, but other skills that may be relevant and transferable in public health. And even before COVID, one of the things that I would do, I don't supervise anybody directly, but I would bring on students to work underneath me, and I would supervise the students. I mean, officially on paper, I'm not a supervisory epidemiologist, but that's fine. I oversaw various students during my time at DPH. So I think, there are different chances and opportunities there for people to kind of make an impact. You just kind of have to think outside the box a little bit.
And I would just love to share quickly that several of our students, I think maybe 3 or 4 of our MPH students who were doing contact tracing and case investigations as their practicum or their applied practice experience were actually hired to be supervisors and trainers. So they, demonstrated their skill level and their willingness to, work hard and be committed and all of those things, and the potential was seen in them enough so that they were hired to actually train others to do that job. So I think that's a great little tidbit too. We don't have any more questions in the chat box, and we have just a few minutes left. So I guess just in closing, I have one final question for anybody who wants to weigh in, is just what would a soon-to-be MPH graduate looking to be hired in a position with the state or local health department, what should they do? What do you think they should do to be competitive, whether it's in, making sure they have specific skills on their resume, or any kinds of like networking activities that they should be trying to pursue, just any kind of closing advice or remarks?
I would go ahead and share my 2 cents here. So actually, I wanted to share because it took me a while to reach this position. So I actually know what happened. So during my journey, I realized that we already gained the knowledge and skills from our MPH program. So we had the knowledge. Some folks are really lucky to have 1 or 2 internships, some were not, and some didn't get that internship opportunity, but everyone has that knowledge. And we all know the drill, that we have to upgrade our resume. We have to work on our LinkedIn profile. We need to work on increasing the connections in LinkedIn. Everybody knows that. But what most of us forget is the perseverance, that we have to be persistent and consistent what we are doing. So don't get discouraged if you don't get any response, or maybe sometimes rejection. It might happen so many times. It happened with me. I myself applied more than 25 jobs in this single agency before getting the final offer. And I got rejections from many positions, and also I got interviewed, but didn't get any response back. But I never got frustrated. I mean, it was upsetting in the beginning, but I didn't get frustrated, and I never stopped applying. And I always knew and believed that that was not meant for me, and I waited for my position. So it took me longer, but it was worth. It was worth what I was looking for. So my only advice is to be persistent to get what you are looking for.
Yeah, I would like to add to Sunanda is that really the opportunity is there, and I think and that's how I landed this opportunity, is because Jessica actually had emailed it out. So, really looking for those opportunities that Jessica and Gina send out, because most of the time they have connections at those places too. So that's already a good, look for you. And, and just having that willingness and perseverance and drive to just accept, even if it's an internship in public health, and not necessarily something that's you're interested, but really just take on that challenge, discover, get your feet wet in other aspects of public health, and just kind of see where, your passion lies, and just really having a drive to, help the community. And that was one thing that was important to me here, was that I live in Gwinnett County, so having that opportunity to give back to the community that, helped raise me and get to this position is really cool. So.
Thank you, Curtis. So that's all the time that we have for today. I want to thank you for attending the Currents of Public Health webinar, and want to thank our panelists for their time and helpful information about advancing their careers in state and local health agencies. Please save the date for our next webinar on Thursday, April 22nd at 12 p.m. featuring Dr. Erin Vinosky-Thomas. In closing, I'd like to share that the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct cutting-edge research on the complex 21st century public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you would like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. Thank you for attending, and please join us for our next webinar.